I will take 1 hour class. So
This call is now being recorded.
I will be discussing regressive alterations of the teeth. Arun, are you able to see my presentation?
Yes, sir.
Yes, sir.
Yeah. Regressive alterations of the teeth. This is one chapter in your third year where it deals only with all the changes that happen to the teeth, especially the hard tissues of the oral cavity. So these are generally considered as old age changes. Usually with age, what happens as we age, there are some things that change in our body, like the hair become gray, usually bones become brittle, and all these things are considered as skin becomes little wrinkled. All these changes are considered as age related changes. That is, when we age, along with the age, our body adapts and some things usually change. Similarly, heart tissues also, as we age, due to some mechanisms that can be physiological mechanisms, pathological mechanisms, or any other mechanism, usually leads to the change in the structures. Some of these may be associated with some etiology, some reason. Some may be not having a specific reason why they change. It is a general change that happens with the age. So most of these regressive changes are usually normally considered as age changes. So these are the things, heart tissue changes that usually see in the oral cavity. So each and everything one by one I will be discussing today. And most of these things, in exam point of view, most of these are 2 marks questions. Sometimes they can ask you for 4 marks also. These terms, if you know the differences clearly between one term to the other term, you can easily identify what these regressive changes are. The first one is attrition, abrasion and erosion, abstraction, dentinal sclerosis, dead tracks, secondary dentin, reticular atrophy of pulp, pulp calcifications, resorption of teeth, hypercementosis, and cementicles. These are some of the regressive alterations that happen to the teeth. And some of these things have a specific etiology. Some of these things are physiological, some are pathological. But whatever this reason, most of these changes are seen in older age groups. That is, as we age, some of these changes appear in the teeth. So commonly you see these changes. Sometimes you may consider them as normal rather than abnormal because they are commonly seen. But as long as the patient is not having any problem, then these changes, no need to worry much about these changes. But when the patient has some specific complaint of pain, sensitivity, or any other thing, then we have to treat the specific problem. So these regressive changes, as I told you, are the regressive changes that happen to the dental tissues, and these can be related either etiologically. These cannot be related either etiologically or pathogenically. So there can be a reason or there cannot be a reason, and these are all general aging process that are commonly seen. Some of these may be due to result to tissue injury also. Tissue damage also can lead to these regressive alterations. Coming to the first one, that is attrition. Attrition is defined as one of the most common physiological wearing of tooth that normally happens daily while we chew the food, mastication.